Hello everyone, welcome again. It's your medic, the D.O.N, that is D.O.N Health Hub, and today we are here again to talk about certain set of life-threatening conditions that usually occur in expectant women. So today we want to talk about danger signs in pregnancy. Now, what are danger signs in pregnancy? This one simply means that these are the things that when an expectant woman realizes happening to her, then she should report to any medical center as soon as she realizes, because they are life-threatening to either to the baby or to both of them. So that's why there should be a quick medical intervention to save the life of either the baby or both of them. So number one on our list, we have vaginal bleeding, sometimes referred to as PV bleeding. So this is not a normal thing. A normal lady, unless not on when they are not on their period, they should not be bleeding. So if you realize you are bleeding while pregnant, then that one is unusual thing. So vaginal bleeding occurs when blood vessels supplying the uterus placenta are disrupted. So some of the causes of vaginal bleeding during pregnancy. So we have things like early pregnancy. So how does this one occur? Early pregnancy, we find that there is hormonal instability or implantation failure. This one leads to miscarriage. So when there's miscarriage, there will be blood presentation. The second one on the list, we have ectopic pregnancy. Now, what is ectopic pregnancy? So during fertilization, we all know that fertilization occurs at the fallopian tube, after which the fertilized egg is supposed to travel down to the uterus where implantation occurs. But now in the case of ectopic pregnancy, after fertilization, that is in the ampulla, this fertilized egg down to the uterus where implantation and growth of the baby occurs. So we find that in the case of ectopic pregnancy, after the egg will be implanted just there where the fertilization occurs, that is it, the fallopian tube, so specifically at the ampulla. So during the early stages of pregnancy, nothing will happen. The woman will just seem normal. There will be no sign of pain or bleeding or anything. But as the pregnancy grows, you find that the pregnancy will become, now it will be larger than the fallopian tube. So this one will result into bursting of the fallopian tube. Hence, there will be bleeding. So that's why that one is another cause of vaginal bleeding during pregnancy. So another one, we have late pregnancy. So we have things like placenta previa. Placenta previa simply refers to the covering of the cervix or the placenta. It's something which is unusual. So it can cover it laterally at the margin. It can be complete, or it can also be centrally placed. So through that one, an expectant woman will be experiencing a placenta abruption. Placenta abruption is just a premature separation of placenta, causing painful bleeding and fetal hypoxia, meaning the woman placenta prematurely separates from the uterus. The fetus will not be receiving, number one, oxygen and the nutrients. So this one will result into death. So that's why these are some of the things that if an expectant woman realizes, then she should report immediately to the medical center that is close to her. So some of how we can manage these things. Number one, any form of bleeding, any place a bleeding occurs, the first thing you should do as a medical practitioner is to do the cannulation. So you insert the branula and replace the lost circulating volume and prevent the patient going into hypovolemic shock. So you can do it with the normal saline or ringer's lactate. Also, you can, in the case of miscarriage, you can give oxytocin, and this causes the uterine contractions, helping the bleeding vessels to expel the retained products in miscarriage. Now again, you can do GXM. That is, you do grouping and matching for blood group so that you can do the blood transfusion. Yes, exactly. And the last one, you can give anti-D immunoglobulin. This one will prevents the resuscitation by stopping maternal immune attack on the fetal red blood cells. Now, the second one on our list is severe abdominal pain. So, pain results from tissue damage, uterine stretching, ischemia, or infection. And now, some of the things that can result into pain. We have ectopic pregnancy. So, during ectopic pregnancy, there is tube distension and rupture that causes sharp pain. Also, there can be placental abruption, as I already discussed earlier. There will be collection of blood behind placenta, stretching uterine muscles, causing abdominal pain. Also, there can be infection. So you find that during infection, there is that inflammatory process. There will be inflammatory mediators which stimulate pain receptors. This will result into severe abdominal pain. Now, you can give the paracetamol this reduces pain by inhibiting prostaglandin synthesis in the central nervous system. You can also give antibiotics. Remember that in case of infection, you give antibiotics to curb the infection. Then you can also do an emergency surgery. And for instance, in the case of ectopic pregnancy, the surgery must be done to remove the ruptured part, and this one also will stop the bleeding and also reduce pain. Yeah. So the third one on our list, we have severe headache. So in conditions like preeclampsia, abnormal placental blood vessels cause widespread vasospasm, leading to reduced cerebral blood flow and increased intracranial pressure, resulting in severe headache. So in this case, you can give methyl-dopa, which acts as a central to reduce sympathetic outflow, lowering blood pressure and gradually and safely. Also, you can give labetalol. This one blocks alpha and beta receptors, reducing vascular resistance and heart rate. Also, you can give nifedipine. We all know that nifedipine relaxes smooth muscles of blood vessels by blocking calcium channels. Then the last one, you can give magnesium sulfate. This one stabilizes neuronal membranes, preventing seizures by reducing neuromuscular excitability. Yeah. The fourth one on our list, we have blood vision. So when there's high blood pressure, we know that this will damage retinal vessels and causes cerebral edema, leading to visual disturbances such as flashlights and blood visions. So still remember that in this case there is high blood pressure. So some of the medications you can give, still you can use magnesium sulfate, which reduces cerebral edema and prevents progression to convulsions. Also, you can give antihypertensives. Remember, it's high blood pressure to lower blood pressure, reducing pressure in retinal and cerebral vessels. Hence, the blood vision thing will be resolved. Then you can give corticosteroids. This will accelerate fetal lung maturity if early delivery becomes necessary. So in a case where this thing is life-threatening to the expectant woman, and also now the medics have decided that there must be a quick delivery, so then later the baby will be taken to the newborn unit for further management. So you will give corticosteroids. This will help in the maturity of the lungs of the baby before delivery is done. Yeah. Then the fifth one, we have swelling of face and hands. Now in preeclampsia, Damaged blood vessels leak fluid into surrounding tissue, while reduced kidney function leads to fluid retention, and this one causes edema. So we the hypertensives to reduce the blood pressure and decreasing fluid leakage. We can also give magnesium sulfate to prevent neurological complications associated with severe diseases. Reduced or absent fetal movements. So when there's reduced movements, this indicates that there's decreased oxygen and nutrient supply due to placental insufficiency or hypertension or cord problems. So in conditions like placenta abruption, which I already said earlier, that is the premature separation of the placenta, you find that there can be reduced or absent, because now the baby is unable to get enough oxygen, the baby is unable to get a nutrient, so this will result into death. So as an expectant woman, when you realize that your baby maybe has not the baby should kick on a daily basis. So as an expectant woman, when you realize that your baby has not kicked since morning, you are supposed to report that matter to the health center, the closest health center, as soon as possible. So this one you can manage by giving oxygen therapy, which increases maternal oxygen levels, improving fetal oxygen delivery, and you can treat the underlying condition in case where there was underlying condition on the condition that was resulting into baby getting insufficient oxygen. First, you treat the underlying condition so that the issue of oxygen can be resolved. Then, in severe cases now, there can be induction of labor, which prevents fetal death when intrauterine environment becomes unsafe. So in severe cases, you can now decide to induce labor, so that the delivery can occur. Now, let's move to the seventh condition, which is also referred to as convulsions. You can also refer to it as eclampsia. Now remember, when we were talking about preeclampsia, it presents with hypertension, high blood pressure that is, and edema. But now, in eclampsia now, this one is a severe form. So it presents with high blood pressure, there is edema, and there is also convulsions. So in this one, these are very dangerous. So that's why an expectant woman is supposed to report as soon as possible, so that intervention can be taken. So in the case of eclampsia or convulsions, this is just, as I have said, it's severe hypertension, and it leads to cerebral vasospasm. It can also lead to ischemia and edema, and that one will cause seizures. Now, how can we manage this one? So still you give a magnesium sulfate, and we know that this one will help in the depression of the central nervous system and blocks neuromuscular transmission and prevents the recurrent of seizures. Also, we can give labetalol, also known as hydralazine, and this one reduces the pressure, preventing brain damage. We can give diazepam. Now, diazepam just controls the seizures and temporarily when magnesium sulfate is unavailable. So now you can go to diazepam. Yeah, and that's all about it. So the eighth one, we have fever with chills. So the moment somebody presents with fevers, the first thing you should question is infection, because those are the signs of infection. So infection triggers the release of pyrogens that raise body temperature, increasing metabolic demand and risking fetal distress. So in the case of fevers, we give paracetamol, which lowers the fevers by acting on the hypothalamic temperature center to reduce the temperature. And as I have said, that when there is fever, we know that there is infection. So the second mitigation, we give antibiotics. This one just to eliminate the bacterial infection, and to remove the bacterial infection. And also now we can give antimalarials. Maybe malaria also presents with fever. So when the test has been done and it is confirmed that now this expectant woman is suffering from malaria. So that is when now the case of antimalarials come in to kill the malaria parasite, preventing anemia and placental damage. Yeah. So the ninth one, we have gush or continuous leakage of fluid, also known as PROM, that is premature rupture of membranes, and that one is something which is very unusual, and if it occurs, seek medical attention as soon as possible. So when we say a membrane, that one is just a covering that covers the baby, and actually before it comes before the cervix. Then so first we have membrane, then cervix. So when these membranes ruptures, there can be leakage of the amniotic fluid, and at the moment there is opening, now the infection can set in. So that's why we should also intervene as soon as possible. So you find that rupture of membranes exposes the uterus to ascending infection and may trigger preterm labor. The moment an expectant mother is exposed to infection, this one can trigger the preterm labor before the term is reached. So how can we manage this one? Still, since it's an infection, we'll give the antibiotics to prevent or treat infection by eliminating the ascending bacteria. Also now, we give the corticosteroids to stimulate surfactant production in fetal lungs, reducing respiratory distress syndrome. So in the case where now the labor has been induced and delivery has to occur regardless of the weeks of the baby, so we have to give corticosteroids. These ones will help in still in the maturation of lungs, because remember, when a baby is born prematurely, the lungs are not yet fully developed. So that's why we are giving the corticosteroids to help in the full maturation of the lungs. So this one helps in the production of surfactant factor, which helps in preventing the distress syndrome. Also, we can give the tocolytics temporarily to suppress the uterine contractions to allow fetal lung maturations. So when we realize that this mother might go into the labor prematurely, we can give tocolytics. After giving now the corticosteroids, we give tocolytics to delay the uterine contractions, so that the corticosteroids can work fully before the labor begins. Then so that when the labor now begins, we'll find that the lung maturations has occurred fully. Yeah. So that one. So on the 10th danger sign of pregnancy, we have painful urination or reduced urine output. And this one, now painful urination, the moment you are having a painful urination, that one can be urinary tract infection, causes bladder inflammation, while reduced urine output in preeclampsia results from renal vasoconstriction. So in the case of urinary tract infection, it will present with inflammation. The moment inflammation maybe of the ureters occurs, now this one will press on the bladder, and the urine outflow will be messed up with. Now that one will lead into reduced urine output, because the urine passage has been messed up with. But now, in the case of preeclampsia, as we had already discussed earlier, this results from renal vasoconstriction. Now, so still we give antibiotics, because remember, this one is urinary tract infection. We give antibiotics, and also we give antihypertensive to improve the renal blood flow, lowering systemic blood pressure. Let's move to the 11th condition, which is vomiting or hyperemesis gravidarum. So hyperemesis gravidarum is different from morning sickness. Morning sickness is normal during early weeks of pregnancy, But now when it becomes more severe, like you maybe a pregnant woman is unable to even retain the meals, so that one now it goes to something called hyperemesis gravidarum. That means severe, you are vomiting severely. So we all know that during pregnancy a lot of hormones are being produced. To be specific, let's talk about HCG and estrogen. So high levels of HCG and estrogen affect the vomiting center. And so we all know that when you're vomiting, number one thing you're losing are the electrolytes, and also you are losing a lot of fluid. So you will go into dehydration, and also this one also will also result into electrolyte imbalance. So we have to intervene as quickly as possible, because the moment you are dehydrated, also we are messing up with the blood pressure. Also, when you have electrolyte imbalances, the nerve transmission, all those stuff will be messed up with. So these ones should be corrected as soon as possible. So the first thing you need to do is you give the intravascular fluids to correct dehydration and electrolyte imbalance. Remember I said that through vomiting you use a lot of fluid and electrolytes. So that's why we're giving IV fluids to correct the first dehydration, and also at the same time you will be getting now the electrolytes. Also you give antiemetics. This block the neurotransmitter responsible for nausea and vomiting. Also you give vitamin B6. This one supports neurotransmitter balance and reduces nausea severity. So on the last one, which is the 12th condition, we have sudden shortness of breath or chest pain. Just all of a sudden you're having a shortness of breath, you are unable to breathe normally, and also maybe you are presenting with a chest pain. So this one can result from pulmonary embolism and severe anemia or heart failure, leading to reduced oxygen delivery. So we know that in the case of an emboli is just a material that is blocking the blood vessel that is supplying the heart. So that one, in the case of pulmonary embolism, the artery that supplies the heart with oxygen and nutrients has been blocked. So the heart is unable to pump normally. The heart's functionality has been impaired. So that in the case of severe anemia, you know that when you're having anemia, there will be reduced levels of hemoglobin. Hemoglobin, these are the things that are responsible for the transportation of oxygen to the different body parts. So the moment you have reduced red blood cells, oxygen supply to different parts of the body will be impaired. That one is also referred to as anemia. Heart failure, also we talk about that one. There will be reduced oxygen delivery. So the first management, the first thing that we'll do is oxygen therapy. The moment the patient or client reaches the hospital, you put them on oxygen therapy. This one will also increase the oxygen concentration. Also, in the case of emboli, when there is maybe blood emboli, you give anticoagulants to prevent clot extension and new clots from formation. So the clot that was causing the blockage initially will be dissolved, and also the more from forming also will be prevented. So that's why we're giving anticoagulants. Also, you can do the blood transfusion to restore. In the case of anemia, when a patient has anemia, you can transfuse them to restore hemoglobin levels for adequate oxygen transportation. Yeah. Okay, so those are just all of the danger signs in pregnancy. I've covered them from number 1 up to 12. There are 12 in number. So you can give us your review or your thoughts in the comment section. Something that we didn't capture well, or something that you would like us to do in the future or in our next lesson. You can all say them in the comment section. Thank you for listening to us.